Colorectal cancer is one of the most common cancers worldwide. Yet, it is also one of the most preventable and treatable when detected early. Screening is our strongest tool. Colonoscopy remains the gold standard for detecting polyps and early cancers. During this procedure, suspicious growths can be removed and biopsies performed to confirm diagnosis. Early detection significantly improves treatment outcomes and survival. Screening is recommended starting at age 45 or earlier for individuals with a family history or symptoms. Today, we will guide you through the full spectrum of colorectal cancer care, from surgery and chemotherapy to advanced radiotherapy options available here at Davao Doctors Hospital.
The treatment for colon cancer is colon resection. So, ibig sabihin naman yun, operation. Putulin yung bituka, kasama yung mga lymph nodes, or kulani, or lusay, yan tawag sa Bisaya, kasama po yun sa surgery. Tanggalin po yan siya para matanggal po talaga yung cancer sa katawan. Okay? Meron pong approaches, either open, ay tinatawag na laparoscopic. The open approach, ito po yung classic one, the classic midline approach na ginagawa for the longest time. And more recently, yung laparoscopic, yung tusok-tusok o yung camera-camera lang. Although meron pa ding hiwa, but not as much as the open one. So the advantage ng laparoscopic is shorter ang hospital stay, less in pain, and then meron siyang cosmetic effect din kasi mas maliit niya yung hiwa. So whenever you get treatment for colorectal cancer, kung meron kayong surgery that needs to be done, please consult your surgeon regarding the options. Huwag mo kalimutan, again, treatment for colorectal cancer is surgery. Hindi po yung mga magic pill, hindi po yung mga whatever na mga binibenta po dyan that will say it will cure cancer. Always consult your physician. Thank you.
The management of colorectal cancer or cancer in general is always multidisciplinary. And my role as a medical oncologist is to assess and administer chemotherapy, immunotherapy, and/or targeted treatment. Same as with other cancers, colorectal cancer has stage 1, 2, 3, and 4. At nakadepende po doon sa stages kung ano ang treatment ng patient. For example, if a patient is stage 2, high risk, then chemotherapy might be warranted and for stage 3. There are also several indications kung kailan tayo magbibigay ng chemotherapy. For those patients na kailangan mag-undergo ng neoadjuvant chemotherapy, ibig sabihin mag-undergo muna ng chemotherapy before cancer surgery, and the goal is to decrease the tumor before we will proceed with surgery. There are also patients na pumapasok sa clinic na tapos na ang surgery. And we will be recommending chemotherapy because we wanted to decrease the chance of future recurrences. And that will improve the survival of our cancer patients. Meron din mga patients na papasok ng stage 4 kung saan we will give it as a form of treatment to suppress or control the activity of the cancer, and that would mean that we decrease the symptoms and at the same time improving their quality of life and prolonging their survival. At Davao Doctors Hospital, the chemotherapy is provided at our infusion unit in a very qualified and safe environment. We do have competent nurses as well as modern facilities to cater your needs. Every cancer treatment is personalized. That will ensure best outcome while maintaining patient comfort and quality of life.
Rectal cancer these days is treated through many means. So usually it is treated with a combination of chemotherapy, radiation, and eventually surgery. Surgery is the most important component of therapy, but sometimes it's not always easy for surgeons to completely get the tumor. So sometimes when the tumor is too big, for example, it's stage 2 to 3, we try to shrink the tumor so that eventually the surgery will be more successful. And by successful, that means that the surgeon is able to get the rectum and the tumor in its entirety. Here in Davao Doctors Hospital, aside from the treatment of rectal cancer through pelvic radiation, we also offer stereotactic radiosurgery or SRS and SBRT or stereotactic body radiotherapy. Now, these are all similar radiation therapy techniques in which highly focused beams of radiation are targeted to certain areas of the body. For SRS, we target tumors in the brain, for example, small metastases, and then treat them to higher doses so that they are eradicated. So these are for patients who have stage 4 disease, right? So you don't need to undergo operation or undergo the usual whole brain radiotherapy. So we can just treat the small lesions na nakikita sa CT scan or ideally sa MRI so that patients have better outcomes and perhaps potentially longer survival.
Prevention is the most powerful defense. Maintain a healthy lifestyle, eat fiber-rich foods, exercise regularly, and avoid smoking or excessive alcohol. Most importantly, do not delay screening. Colorectal cancer requires a multidisciplinary team. Surgeons, medical oncologists, and radiation oncologists working together to design a comprehensive, personalized treatment plan. Early detection, coordinated care, and timely treatment save lives. At Davao Doctors Hospital, we are committed to providing the best doctors and the best services, delivering quality, compassion, and excellence in every stage of care. Your health matters. Early detection saves lives. And we are here to give you the atiman you deserve.